But it's my pleasure actually to announce the first speaker this morning, Professor Chris Trotter, who's actually, I'm allowed to call him a friend of the association. He's previously presented at PPOA events as well, most recently in 2013. And Professor Trotter has worked for many years as a practitioner and manager in adult corrections prior to his appointment to Monash University in 1991. He's undertaken many research projects and published widely on the subject of effective practice with involuntary clients, particularly those in the criminal justice system. So right in our vein of work. He has an international reputation for his work, particularly in relation to pro-social modelling. And his book, which you may have heard of, Working with Involuntary Clients, is now in its 3rd edition, and it's been published in multiple languages and sold widely around the world. Professor Trotter is a director of the Monash Criminal Justice Research Consortium and is currently engaged in numerous research projects, including projects on effective supervision skills, ageing offenders, children of offenders, and community service. So it's my pleasure to welcome Professor Trotter to the stage this morning.
Thank you. Yes, thank you for the invitation to come and talk to you. It's nice to be in Sydney again, and it's preferable to the 36 degrees that I left in Melbourne. So what I'm proposing to do in the next hour is to talk about the research about what works and what doesn't work in the one-to-one supervision of offenders. In particular, how what you say and do with people when you supervise them as probation officers or community corrections officers, what happens in that interaction and how that relates to the reoffending rates of the people who are being supervised. So I'm going to talk about the research, a lot of the research that I've done, and also some of the research done in other places particularly over the last 10 or 15 years. And I'm aware that I've spoken to a number of you before. Many of you have probably heard this stuff once or twice, but some of you won't. And I'm aware also that you're familiar with a lot of the material that I'm presenting to you, so I guess you see this as a bit of an update for some and maybe something new for others. So this is the most quoted quote in the history of quotations, I think, this Martinson quote, which was done many years ago. And the authors undertook, or aimed to undertake, a review of all of the work that had been done looking at the relationship between correctional interventions and outcomes, particularly in terms of reoffending rates, in the published literature at that time, many years ago, but with the conclusion that nothing works, that the issues which face offenders, including those who are under supervision in probation orders and correction settings, the issues that they face are so overwhelming that to expect maybe 20 minutes or 30 minutes every 10 days sitting down talking to their probation officer is hardly likely to make any difference to their lives. And this was certainly a view which was very prevalent when I started working as a probation and parole officer in Victoria in the 1970s. The view was nothing seems to work, so it doesn't really matter that much what you do. Unfortunately, whilst that was true 40 years ago, the evidence still seems to suggest that if someone's placed on probation or on a community corrections order or on a supervision order, and you compare them to someone who is placed on a bond or a fine or some other non-supervised disposition, and then you look down the track at the offending rates of those people, matched groups, some under supervision and some not under supervision, the differences still remain very minimal. So 40 years after the Martinson findings, with all the knowledge we have about what works and what doesn't, we still continue to get this situation where overall, if you take people on probation compared to people not on probation, you get a slight advantage for the people on probation, but it's quite slight. Which is not to say that corrections supervision, community corrections supervision, doesn't work. What appears to be more and more evident is that community corrections supervision does work, but it works sometimes. And it doesn't work if it's not consistent with the what works principles. So if you have corrections supervision which is clearly based in theoretical principles and based in the research about what works and what doesn't, then it does work. It does reduce reoffending. But if you just do service as usual, the kind of interviews, I must admit, I did many times in the past, you're still in the same accommodation and how you're getting on with the family, and you remember you shouldn't be using drugs, and have you kept your appointments for community work? Okay, well, I'll see you next week. And this kind of, what I'd call it was supervision. There's kind of it's what you do if you don't really know what to do or what else to do, which I must admit is what I did for many years as a community corrections officer. But the evidence is increasingly evident now that in a large range of studies, whilst the overall impact of correctional supervision is maybe minimal or maybe have some advantage, but overall not a great deal of impact, some people are having a great deal of impact and some people are not having a great deal of impact. And there's two recent systematic reviews or meta-analysis of the impact of supervision undertaken by corrections workers. The terminology for corrections workers leaves me totally confused, I must say, because it keeps changing. I was a probation officer when I started, then I became a community corrections officer. You're community corrections officers, are you? Is that what you... I must say I like the term probation officer personally. It stood the test of time. And there's still many probation officers. In fact, for the most part around the world, community corrections officers are called probation officers in most places, I think. By the way, so anyway, these two particular reviews have attempted to look at all of the work that's been done, looking at the supervision of offenders based on effective practice principles. And one of them is a systematic review which I did, published in Federal Probation recently, and I was able to locate 8 different studies which have either trained people in effective practice skills and then looked at the reoffence rates of the clients of the people who've been trained in comparison to other groups, or to examine, in the most cases, audio tapes or videotapes of interviews between workers and their clients, and then follow them up to look at whether people who are using skills are using the skills, more skills compared to people who are using less skills. And then these studies have compared the people using skills, good skills, compared to people not using good skills. So they've rated the extent to which the skills are present in the interviews. And in the studies that I looked at, there was one which found a 60% advantage. So effectively, the reoffence rate went from something like around 50% down to 20%, based on whether or not the supervisors showed that they were using effective practice skills when they were observed on audio tapes or in videos. Of these studies which did this, which looked at either people who'd been trained and then followed up the clients, or examination of what they were doing in the interviews and followed up the clients, the lowest was 20% and the highest was 60%, and the average was about 33% over all these studies. So these were specific studies really effectively comparing people who were trained or who were using skills, particular skills, versus supervision as usual, or versus supervision which appeared to, undertaken by people who appeared to have less skills. So then another meta-analysis published just very recently, just last month, undertaken in Canada, found very similar outcome with where people were trained or using skills. They had, well, in fact, this is just where they were trained, where they'd been trained, and then there was follow-up with the offenders. They found a 28% reduction in the average reduction in the reoffence rates. Again, which varied somewhere between sort of 20% and 50%. So it does seem that this view that 25 minutes once every 10 days or whatever, the idea that this can make no difference, it seems quite the contrary, that such a small amount of contact relatively in the lives of the people being supervised seems capable of having a very dramatic impact. In fact, if you're doing a risk assessment, one of the clear risk factors in terms of the likelihood of this person completing their order or committing further offences is the chance, the pure chance that they get a probation officer, community corrections officer with good skills. The community corrections officer appears to be pretty much as important as the number of prior convictions in terms of the likelihood of the offender committing further offences or breaching their community corrections orders, which to me is a pretty scary prospect. But the evidence keeps saying it time and time again that this interaction with community corrections officers is hugely, can be hugely beneficial, can make no difference, and can potentially actually do damage. This is what the more and more research over more and more years is continually saying. So these are the skills which most of the research projects have incorporated into the training that they've offered, or these are the skills that they've attempted to rate or score when they've done observations of interviews between community corrections officers and their people under their supervision. First of all, target medium to high risk offenders, which this has really become just part of the day-to-day practice of community corrections all around the world, is to identify risk levels and then attempt to target the higher risk people with greater levels of supervision than the lower risk people, on the basis that when you give a lot of attention to lower risk people, you can give them a sense of being criminal, draw them inappropriately into the system. For the most part, there's a large group of offenders in most settings where 95% of them are not going to end up in prison in the next 2 years, and you're best off just to leave them alone or provide them just with just a minimal kind of service. So this has been the wisdom which has developed over the last 20 or 30 years. I must say, in a lot of this research, good practice is good practice for everybody. It's certainly in the research that I've done. If you do good work, it doesn't matter who they are, who you're working with, there's benefits for the offenders. That's what's come up in my research continually. There's also some arguments in some of the material that there's a certain group of offenders, very high-risk offenders, perhaps 5% of offenders who are kind of unreachable. So the concept that target high-risk offenders, you'll get the best benefit, is clearly true, particularly if you're just doing service as usual. But at the same time, a lot of the research has suggested that middle and medium risk offenders may in fact benefit the most from good quality supervision. But if you're going to do service as usual, or a punitive style of surveillance style of supervision, then don't do it with the low risk offenders, because it's going to be pretty unproductive, I think, is pretty much the message. The second principle which we've coded for in these tapes that we've done is helping the client understand the role of the community corrections officer, which is quite different to ensuring that you've explained the conditions, which when I was working, I always had to write down, explain the conditions, and then if I went to court, I'd say, yes, I explained all the conditions of the order, and they still didn't report. But it's quite a different concept. It's actually ensuring that someone who may have limited memory, brain damage from various reasons, drug use or whatever, ensuring that they actually grasp what's going on, which is quite a different skill to explaining the conditions. So the more successful workers would be not going on and on about the conditions, but just making sure with questions that the people they were working with actually knew what all this was about and what was going on and what they couldn't do and what they could do, what was negotiable, what wasn't. The concept of pro-social modelling and focusing on strengths. All of the research says if you talk to the offenders about what they do well, if you find things that they've done well, whether it's they've been looking for work or they've stayed out of prison for 6 months or whatever it is, if you focus on the things they do well and that is the focus of the conversation in your interviews, then the outcomes are better. If the conversation is about past offences and about how you shouldn't do it again and these kind of things, it seems to have a negative effect. The concept of the criminogenic needs, like focusing on things which are related to offending. Although again, this concept, it's very much embedded in community corrections practice. But at the same time, there's often things that get people out of offending which didn't actually get them into it. And I take it as an example, being single, not having a partner, for a young man, you wouldn't classify that as a criminogenic need, I wouldn't think. You wouldn't have it down as criminogenic need needs a girlfriend, probably. But in practice, it is one of the most protective factors in terms of reoffending of anything a young man can do, is develop a relationship with a girlfriend who is not a offender. just classifying that. So your energies as a community corrections officer in helping someone how to develop relationships could be very well expended in terms of reducing reoffending, even though it's not a criminogenic need. So the concept of problem solving, there's quite a variation in a lot of the research on this. My view is that you work with the issues which the offenders see as issues, whether that be getting a girlfriend or whatever, or finding employment. If you can see it as in some way related to that person achieving a more pro-social lifestyle. But for the most part, whether they're criminogenic needs or not, well, the issue is, can this help the person to develop into a more pro-social person? And you're more likely to get an outcome in that situation if you're starting where the offender is, like you're working with their concept of the issues rather than one that you've defined. And this all works better in the context of an appropriate client-worker relationship. I've got a DVD which some of you may have seen, so hopefully most of you haven't. I've been using it for quite a long time, actually. What we've been doing with a lot of the research we've done, and we've done a big project recently in juvenile justice in New South Wales, observing interviews between the juvenile justice workers and their clients, and then we would rate the interviews in terms of, is this a good interview or not such a good interview, rated on a scale of 10, and then we'd look at how our ratings compared to the reoffending rates of the offenders. And what we found was when they rated high, the people offended about half as often, their clients offended about half as often as when they rated low. But I've got an example of a couple of excerpts of interviews which I'd just like you to look at and see what you think. If you were doing a rating, how would you rate these on a scale of 10? So we'll go with the first one.
Jennifer, thank you for coming in today. My name is Michael Schell. I'm going to be supervising you on the order during the early stages, and I'll explain the processes to you. I understand that you've been in court last week and you got a community-based order.
Yeah, that's right.
And then you came to Correctional Services 2 days ago for your first interview and filled out a number of forms. My role will be to make sure that you comply with all the conditions of the order, but I'll also be there to help you to work out with some of the problems that you've got. One of the things we need to get going fairly quickly is implement the conditions of the order. Did you have a check of that? Did you have a look at the order yourself?
Well, they gave me all this information, so, I mean, I don't know.
Yeah, that's a copy. Can you look what the conditions are on that? What you got to do?
To do community work of 100 hours over 12 months, to submit for testing for alcohol or drug use, to undergo assessment and treatment for alcohol or drug addiction, and to submit for psychological or psychiatric assessment. I don't have a psychological disorder or anything like that.
It's sort of standard condition that's written in the legislation, but the main part for you in the court, I think, identified that it's a drug problem for you, so we'll focus largely on the drug problem.
But I don't even think I've got a drug problem anyway, so why should I go for an assessment?
I guess the court sort of put that on. You agreed that that's what you're going to do, relates to your offending, so my role is just to make sure that you actually do that at this point in time. And to get that going, there's some other conditions, I'll explain those to you in the bottom shortly, but I think we need to sort of get going with that fairly quickly to get the community work organised for you, but also get the drug assessment completed, and I'll need to contact you for drug testing today. So we'll expect you to do over the next few weeks to, on a weekly basis, to provide a sample for me that will be at a...
What kind of a sample?
It'll be a urine sample, and it'll be performed at Dorevitch Pathology. That's the agencies that we use at the moment. So you have to go and provide a urine test, which will be supervised.
So that people are actually going to be watching me?
Yeah.
Why do I have to do that?
Well, they have to know that it's yours, otherwise you could just bring in somebody else's and we wouldn't know. So we need to establish what's in your system so we can work with a treatment agency to identify what drugs you're using so that we can then put some changes in place for you. In relation to the assessment and treatment part of the condition, what we'll do is we'll get you contracted to an agency in the city. They will
all the way in the city.
Yeah,
I mean, that's too far.
Yeah, it's the only place we've got. There's no one else you can go. It's in Spencer Street. You can hop onto the train and hop out of Spencer Street station.
And how long do I have to? I mean,
it takes about an hour to interview, and you'll see one of the clinicians there who will take you through some questions and talk to you about problems that you've got. And they'll write us a report with some outlines as to what treatments they're going to put in place for you.
But you just said that you're going to help me with my problems and stuff. Why do I have to see other people as well?
Yeah. With the treatment aspect, because I'm not the expert in it, we'll get them to do that. And we'll refer you out to one of the drug counselling agencies. They will make the arrangements for you, send you a letter, depending on the outcome. If they feel that you've got a drug problem, they'll arrange the treatment for you at a local agency.
Well, it's going to be a waste of time anyway because I don't have a drug problem anyway.
You've got to do it, unfortunately. There's not much we can do about it. The court told you had to do it. You signed the order, so it's your responsibility that you complete it now. If you don't comply with it, you have to go back before the magistrate and explain why you don't want to comply with it. So you've got to go through the court process again.
Well, I mean, look at all this information I was given. I mean, how am I supposed to remember all this stuff? I mean, all this community work and, I mean, they gave me this firearms thing. I don't even have a gun, so, I mean, it's just a waste of time. I would have rather just gone to jail. Yeah. I mean, I'm never going to get through this, so...
Look, we'll try and sort of get things in place for you and get all the things organised. Before you leave today, we might go through some of these forms again, clarify any one that you're not sure about. It looks like you've signed them and suggesting that you accept what's in those.
Well, I didn't have a choice really, so I had to sign it. What else am I supposed to do?
Yeah. I guess there's some forms that you just have to fill out in terms of your understanding of what you need to do, and there's not much we can do about that. It's just the way it is.
That would have gone into the not a very good interview example because it's essentially not collaborative, and at the end of the day, has the offender got a good picture of what's required, and have they been kind of helped to understand the process and work through it in some way. So that would be, we would have classified that as a relatively poor interview, and that was the kind of interview which led to the poorer outcomes when we did the coding with the research officers. Mind you, when we did the coding, we had quite a detailed coding manual, and the people practiced doing coding on various interviews. So the coding itself was quite a sophisticated process. So I'll show you the other version, and this is a version which we think is a better way of doing it.
Jennifer, thank you for coming in today. I'm Michael Shield. I will be supervising you on your corrections order during the early stages. And one of my roles will be to make sure that you get through the order and you comply with all the conditions of it. And the other part will be to work with you on any of the problems or issues that led to you getting in trouble with the law in the first place. So in relation just to the first part here, we might spend some time just clarifying what your understanding of correctional services is for you, what you think your expectations are of me, and any conditions or part of the order that you're maybe not sure about. So maybe you could provide me with some feedback on what you're expecting.
Well, I mean, last time I came in I was given all this information.
Yeah, it's overwhelming, isn't it?
It is, yeah. And the one over here, it's got all the conditions which I think you're talking about, like community work, 100 hours, and alcohol and drug use testing and stuff, and assessment and treatment for alcohol and psychological counselling. I mean, I don't understand why I have to, you know, get psychological counselling. I don't think I've got a, you know, disorder or anything, and I mean, I don't even think I've got a, you know, drug disorder. So I don't understand why I've been given this to do.
Yeah. Was any of that explained to you when we were at court with a court-advised worker?
A little bit, but
Yeah.
I don't know, everything was sort of rushed and
It's a lot of pressure when you're at court, isn't it?
Yeah.
Do you want to go through some of those things and want me to explain them and work with you through that?
Yeah.
Okay. So the first part is the community work that you got on there. So your 100 hours. What we usually do is try and find you a site that helps you to develop some skills or something that you're interested in. It might be something in terms of horticultural program where you can develop some skills, or maybe something that relates to other skills that you have an interest in. You're usually expected to do 8 hours each week. So we'll find a work site and I'll get some feedback as to what some of the interests are that you have, and we'll try to match that as close as possible. We are limited with the sites that we've got, but we'll certainly try and match something close to that, and I'll let you know what that is. So today we'll talk briefly about the days that you might want to do your community work, and you can do it between Monday and Saturday usually. So it fits in with any other requirements that you might have in terms of employment or
Yeah, well,
education.
I don't have a job at the moment.
Okay, so you could do it during the week.
I could, it's just that it depends where it is. Are they going to be far away?
And we'll try and actually get it as close as possible to where you live, and we'll usually give you some information in terms of public transport so that you know which bus route or trains or trams that you can catch to get there.
Yeah, it's just that I'm a bit short on money at the moment, and I mean I had to catch a bus and a train to get here, and you know I have to have some money to buy food and stuff. So I mean, how many times a week am I going to have to see you?
At the early stages, you probably need to see you, say, twice a week till we get a couple of those programs implemented. Once that's done and you're attending on a regular basis and you're doing all the right things, then we'll reduce that. It'll be weekly and then fortnightly, and as you're progressing and doing well, it gets to the stage where you might only have to come in once every 2 months, and it'll be more just for reporting to make sure that everything's going okay, there's no changes in your accommodation or any other issue that you might have.
And just about the community work, I mean, am I going to have to work with, you know, other people, like people who are murderers and stuff like that?
What we usually try to do is find a site where only you are on your own, with nobody else. And that's what the aim will be.
I'd prefer that if I was on my own.
Yeah.
And so if I complete the 100 hours, like let's say in 3 months, does that mean I'm off the order?
Not quite. I mean, you've completed then one part of it, which is a very important part of it, and it'll be good progress, and certainly, you know, we'll take that into consideration in terms of how often you have to come in for the reminder of the other conditions. But some of the other conditions you've got on there, as you notice, is the treatment aspect of it and the testing aspect. And we might need to spend a few minutes just explaining that and discussing that together.
Yeah, I'm not really keen on the testing bit. I mean, is that injections? Is that a blood test or?
No, it's actually a urine test that you provide at a laboratory. We usually use Dorevitch pathology to do that. So there'll be a nurse there that will supervise you to do a urine test.
So they'll actually be watching me?
They have to, yeah. Largely because we need to know that it's actually your sample, that's not somebody else's that's been brought in.
Well, I'll prefer a female nurse if that's all right.
Of course, yeah, certainly. And as part of the order too, you know, you're entitled to actually have a supervisor of your own gender if you prefer that. So you're certainly welcome to let me know before we finish the session today whether that's something you want to do. Yeah, but yeah, certainly it will be a female nurse that will be watching you. They will be accountable for the sample data collecting and analyse it, and they provide us usually with a test result the following day or 2
So
days.
they're actually looking to see whether I've been using drugs and
Yeah,
stuff
what sort
like
of drugs on your system, and that really helps the treatment agency when you go for counselling or so. So they know what's in your system, and they can then work with you and say, okay, it's a particular drug. Let's focus on working with you to maybe reduce the use. And hopefully your goal will be that throughout your order that you'll cease illicit substance users.
So what if they do find something? Will I be in trouble, or what will happen?
No, you will only be in trouble if you don't go, if you don't attend. If there's something in the system, it's really to help us to guide you and the counsellor so that we can discuss in supervision what are some of the issues, why are you using drugs, and look at some of the problems that are surrounding that. And it helps the counsellor to focus on that particular drug use as well.
Well, I mean, I don't think I've got a drug problem anyway, so I don't think, probably
I've
waste
sort of
time,
noticed
really.
at the file that you've been in the juvenile system for on a number of orders, and they seem to be all drug related, those offences. Now you're in the adult system, and you've got offences in relation to burglary and theft, which seem to be related to drug use. So there seems to be some issues that you may want to look at, and then make sure that you don't come in trouble with the law again down the track, because the consequences could be more serious each time you go before the court. So one of the other conditions is that you mentioned before is the treatment and testing aspect, or the treatment aspect. And initially what we'll do, we'll send you to an agency that's in the city. They do all the assessment for correctional services
Isn't
in
there
Victoria.
something a little closer? I mean, City's a bit far.
It's unfortunately, but they've just got one head office in Spencer Street. You know, near the remand centre down there. So you could catch a train into the city, and it's about 10 minutes walk from Spencer Street station. It'll be just a once-off situation, and it'll be about an hour for an interview with them. They then rate us a report on the information they get from you, and develop a treatment plan for you and make arrangements for you to be seen by a counselling agency in the local area. So it'll be somewhere close to where you live at the moment.
It's just so much things that I have to do. It's just seems so hard. I mean,
There's a lot, isn't
I
there?
don't see myself getting through this.
Yeah, we can certainly help you with that, and we'll take each step at a time. So we'll get the community work organised. Initially, it's really overwhelming because there's so much information to retain and work through. As you see on the order, you've got 4 conditions of community work. So once you get that started, you'll find that the hours gradually work down. They'll reduce to the stage where you finish the community work. You come and see me in relation to the supervision, so we can have a look at all the issues that lead to your offending, and we'll work at some strategies and how you can deal with those.
I mean, like 12 months is such a long time.
Yeah.
I mean, I was under the impression that once I finished the community work hours, it would be finished.
It'll
I thought
be
that
all
was my
finished,
punishment. So
It's interesting that people say that often, but because we've got a range of conditions attached to that, we'll need to deal with all of those as well. But certainly, once you go into treatment or the counselling part of it, and the counsellor after 2 or 3 sessions feels that you're dealing with issues in your life, you're no longer required, then you've completed that part, they'll exit you from treatment. If we feel that you don't display any symptoms of drug use, we'll take you through an initial few stages of testing.
Okay, we're running a bit short of time, so I won't play, but there's just another minute or so to go. Who'd like to volunteer a score for that one? 7, 9. So clearly better. So there's nothing very magic about the good skills versus the not good skills, but there's a very clear difference which seems to be very easy to see, which we found when we've looked at the interviews in these various studies that we've done. Would anyone like to comment on what he did well then? He rolled with resistance, he did, yes, rather than challenging it, most in particular. Anything else? Yes, and he was validating what she was saying. So it's essentially sort of relationship skills, I guess, but also putting a lot of energy into just helping her understand what was going on and how she could do it. Getting it from her perspective rather than from his. So, I'll just mention one or two other studies before I finish, and we can have some questions. This one's one that's done in Canada, which involved providing training to community corrections officers in effective practice skills, but also providing ongoing coaching and supervision to the staff. So the people involved in the project, they undertook training first, but then they would bring audio tapes of their interviews to group supervision. So each of them would bring audio tapes along to the interviews, and they'd discuss what went on in the interviews, and the group, including the group leader, would then provide feedback to the community corrections officer about the use of skills. And so then they followed up this group, the offenders are the people who'd undertaken the training and been involved in this ongoing coaching process. And so they're saying that the reoffence rate post-training for people who were involved in both the training and the coaching was 15% compared to 41% for 2 years beforehand. So effectively it's considerably less than half the reoffence rate that they were having prior to being involved in this project. The second one there is it's a 24% reoffence rate after 2 years, but these particular people had been involved in the training, but they weren't participating in the coaching with the audio tapes, which was on a voluntary basis. So some people participated in it, some people didn't participate in it. But those who were kind of embracing the concept, done the training and using the coaching process to progressively improve their skills, had these, what to me are just absolutely astounding outcomes. And this is a study we've recently done in youth justice in New South Wales, where we observed, research officer observed, or a number of research officers observed about 130 interviews between juvenile justice workers and their clients, many of them in outback and rural New South Wales, where it would take sometimes 4 hours to get there and back for the 20-minute interview, which they did when they arrived, as I'm sure you're aware. But again, we got... whoops. Where's it gone? Yes, in terms of young people going into detention, there was a very substantial reduction where we rated people as using the skills from the audio tapes and from the coding of the interviews. And similar in terms of completion of orders without further offences. That don't have a very high rate of order completion in New South Wales for juvenile justice, but it was twice as good where we judged the people as having the skills, or where the research officers coded the people as having the skills. So just by way of conclusion, good worker skills lead to lower reoffending, including pro-social modelling, problem solving and cognitive techniques and role clarification. The difference between reoffending between those supervised by skilled workers and those supervised by less skilled workers is somewhere between 20 and 60%, and the skills impact on failure to comply as well as reoffending. And it seems that workers can learn these skills Some people have them naturally, others are less inclined towards that kind of style of practice, but they can learn them through training of as little as 20 hours, which has been shown in similar training courses in different places around the world. But we know that routine supervision in the absence of specific training generally has minimal impact. Some workers do well, some workers don't. Some have good skills and some don't have good skills. So I've got about not very long for questions, I don't think.
Grab some roving mics.
Okay.
You happy to stay up there?
Sure, yeah.
We talk a lot about the idea of challenging an offender in interviews.
Yes.
But we also talk in motivational interviewing about the importance of rolling resistance
Yes.
and avoiding confrontation.
Yes.
Those two seem to me to be somewhat exclusive.
Yes.
Is there a better word we could use rather than challenging?
Well, I don't think confrontation's a very good word because it kind of implies a sort of a underlying forcefulness, which is not really appropriate. I think, pointing out discrepancies and helping people to understand that, that their comments are kind of self-defeating and rationalisations, that's very much a part of good practice. The terminology of challenging I think is not a bad word really, it's better than confrontation, but the challenging, respectful challenging might be a better word. All the research suggests that interviews which have a lot of confrontational challenging in them create resistance, and the result is that you have not a collaborative. You don't have a collaborative interaction. But certainly it's important that the good practice involves some comment to the offender that the rationalisations they make, the pro-criminal comments they make, are not productive for them and they're not really acceptable from the community corrections officer's perspective. But where the challenging is a respectful, questioning kind of thing, it seems to work well. Where it crosses the line to create resistance is where the problem becomes. But I think one of the difficulties with motivational interviewing and the concept of rolling with resistance is it's not geared towards work with offenders, and hence it doesn't really accommodate the need to pick up on the pro-criminal things that the offenders say, which is an important part of the work which supervisors do. I think the word's respectful challenging, I think is a good way of describing it.
So I was going to add to that. In the realms of coaching, I think they invite conversation about certain topics,
yes.
On certain things.
Yes.
And perhaps the word debate. Let's discuss this.
That's good.
Let's have a conversation, and in that
yes.
conversation, it's two people engaging in questioning, debate.
Yes.
And then, not so much challenging, but it's, so how is it that you think that way?
Yes, exactly. So it's a kind of it's a debate or sort of unpicking of the situation or careful questioning of the offenders about the offender's comments and views. But it's a very important part of the work, and when it's done well, it can be very effective. But there is, in the interviews which seem to turn, you could see in the interviews which we watched, when the kind of respectful challenging turned into a kind of confrontation, it turns the offenders off. You might as well not bother, that because they stop listening.
Hi, I'm just interested in your opinion on. I've heard a lot about how it's important, the relationship between the CCO and the offender.
Yes.
I just understand that it's common practice, from what I can see, that an offender would be very lucky to have one CCO for the entire sentence.
Yes.
So they may have up to 5.
Is that right?
That a huge impact on the outcome as well, or of our effectiveness of being a change agent, and they're reoffending or getting through their order when they have maybe up to 5 different, with skills or without skills?
Yes.
And I'm interested too in the research. Was that based on them having one CCO for the entire sentence? And like I say, your opinion on how that affects.
Some of the studies have been controlled for having a minimal time with the supervisor. In the first study I did in my PhD, we only took people who had at least 6 months supervision with one worker. And in a number of the studies, they've excluded people who've had many workers. We found in the juvenile justice study that if people had the same worker for the whole order, they did better. And if they had the same worker for most of the order, they did better. They did worse if they had lots of workers. That's if the workers had good skills. Like if they had 1 or even 2 workers who had good skills, they did well. But my feeling is that it's more to do with the skills of the worker and the consistency between the workers. If someone has several workers and they're encountering quite different expectations and different working styles, then I think that seems to be a lot more problematic than if you have 2 or 3 workers who are all essentially working from the same orientation and all who have good skills. Hope that answers your question.
I've got 2 questions, if I may. With the training and the good skills of supervising officers, you put up the slide, I think it was from Borgon et al. 2010, which was saying that those that received the training but then had low clinical support, which you said was voluntary, the submission of audio tapes. Does that not imply that if a supervising officer doesn't have commitment to their own professional development and a willingness to engage in in skill building, then training won't make a difference because that wasn't a difference?
And look, this is a very good question because the question sort of arises, have we got these training junkie people who love going to training and keep learning and learning, and hence the ability to actually develop good practice across the whole organisation is may be compromised because the people in these research studies are in fact this particular group of people who are choosing training and coaching and so on. So it creates this question, do these people come to training with the skills anyway? Are these the sort of people who are good in any case? But some of the studies have looked at this. But we took, when I did my PhD, we took the people who, we had about 25 people started training and about 12 of them didn't finish because they dropped out or they got another job. And we actually compared their outcomes, those who dropped out compared to those who completed. And those who dropped out did no better than the control group. So there were actually people who'd volunteered for training but couldn't complete. I think it's fairly clear there's a factor. There's a factor which is some people are just oriented to learn and they probably do better overall. Some people would rather not get involved in training and so on. But there's an effect of both the training and the individual. There's 2 things going on. One is the willingness to learn. The other is the content of the training.
I had one other question as well. You mentioned earlier in your talk that you work with the issues that the offender see as issues, working from their concept.
Yes.
I just would like your opinion on a lot of the time the risk factors and the criminogenic needs that have been identified have been identified in the risk assessment tools that we do, and the offender doesn't see them as risk factors. So how do you propose that we work with an offender when we're trying to work on issues they don't see as issues?
Well, I think my view is that you work with the offender's view of the problem, but you work towards identifying issues which you feel are related to the problem. So the offender says they want to work on housing. You say, okay, let's start with housing. Let's explore what's happened in the past. You say, oh, some of this housing is broken down because you haven't had enough money. So you unpick it. So you haven't had enough money because, is that related to the drug use? You seem to have lost, 3 or 4 different accommodation that you've found. You've had to move out because of lack of money, or what's the reason for this? So ultimately, you work with the client's view of the problem, but you work towards, I suppose, your definition of the problem or your definition of the criminogenic need, and they tend to merge. But if you just start with your problem is drugs and we're going to work on it, you just end up with resistance. But you can work towards it. But there is another point, and that sometimes the assessment it isn't necessarily accurate. The assessments are not all the time accurate. The risk assessment may say that this is the cause, but the offender actually may know better in some cases. They might know what their problems are more than the worker sometimes.
Can I just quickly make a comment on that? And you'll see we cover this in the handbook quite extensively, that there's a difference between the factors that are statistically correlated with offending on a large scale and the factors that lead to offending on an individual basis. And that's where exercises like offence mapping, where you go through the actual cause-effect linkage with the offender, as opposed to just saying, oh, well, there's drugs here, drugs must be the problem. So making sure that you do that with each individual.
Thank you, Professor Tate, for, I guess, speaking our language. I think we could probably speak with you all morning and ask all sorts of questions about, I don't think any of us want to supervise as usual, and we definitely don't want to do any damage. So speaking our language, that's just wonderful. So thank you very much for your time.
Thank you.
Thank you.